Good day, dear viewers, and be welcome today to the next or second broadcast about the immune system, and I would like to introduce you to the actors of our immune system today. We have all learned a lot in the last few months. And what we have experienced should be a great life lesson for us. Because this shock and really thinking something out of fear was not always the right thing to do. At the moment, I think we all lack trust in life, but also a lot of knowledge and to better assess the risk tomorrow, the personal risk, but also from a medical point of view, the social risk. We all have to be better prepared because we ourselves, we humans, have created this world as it is today. And we will no longer stand alone and feel on your own, and above all, please never think that we have to be victims in any situation, and this deep, great personal defense that we carry within us builds on a reliability of 100% and more. That means, let me take the term of a real line of defense that we have an army within us on which we can count to any point in our life, just like the guard that guards the Pope, like the army that guards a society. It is the same in us. That means these troops, these defense troops are always ready. They are incredibly efficient, they are very fast, they have a lot of active fighters among them. They also have special units and they all have one goal: to defend us in the confrontation with life, with the living organism, with the earth, with all its burdens that the earth and life on earth, also the human being as part of this nature. Confronts every day, and if you are born as a human being, then you were in the womb of the mother for 9 months. And the immunity of a child is not at all matured with birth in a very, very first phase, it is not at all adaptable to life, so a child needs an infant for a long, long time. This nest protection, and the best nest protection, is given to him by the mother holding all the antibodies, all the defense mechanisms for the child. Over the umbilical cord, which the mother can provide to the child. If a child has a normal birth, which we of course always welcome, then this birth is connected with a first vaccination through the mother's birth canal. We really call it vaccination because the child naturally absorbs vaginal mucus through the opening of the mouth, and at that moment, of course, a lot of very, very many useful bacteria are born, so the term bacterium or microorganism must be very healthy and normal for you in understanding an immune system. Please forget that bacteria are occupied with a negative term for your whole life. Also with the topic of tumors, I don't like that word, and what I don't like at all is the word cancer because it makes it bad from the beginning, and the bad needs a radicality, but it doesn't need that at all because we shouldn't think so black and white. We have to learn to understand the microorganism and to accept it lovingly, because life is not dead matter like the table I'm sitting here on. It will always be like that if we don't grind it off nicely, but it won't change. Life in us is life. These are microorganisms that do all these tasks for us to defend us, and that's also the incredibly many good bacteria, and in the other broadcasts, so piece by piece I will show you which part of it can cause disease, but most of them have a huge task to have us in life or alive, always adapted, and this recruitment, this recruitment, so coming out of nowhere a bit relative, but being born. Means with the first vaginal vaccination that slowly this new life recruits its soldiers, but slowly demands them, builds up so that they build up a strong immunity, and that happens. Of course, in the course of life for the children in this great first year of life, very decisive. On all levels, and I would like to transition here and show you a first slide, and you can see on this first slide that we have a so-called defense line, and I'm talking about border areas here, because if a cough reflex is triggered, then it is deliberate, because with this cough reflex there is a permanent stress on the mucous membranes of the bronchial system of the esophagus, or not the esophagus, of the trachea there. That means through the cough reflex I bring something outwards that I don't want it to penetrate inside. Remove mucous membranes. If I have strengthened a mucous membrane over the mucous membrane today, then I always have to know the body doesn't make a mistake here, but it needs this mucous membrane to ensure a so-called excretion, a diversion on a level of mucus, because it is overwhelmed with the stress on the mucous membranes. These mucous membranes would slowly reduce if perhaps on the other level it would be recognized why the body, this emergency valve here via the strengthened mucous membrane via the respiratory tract, starts processes and leads it out over the mucous membrane. The skin barrier, for example. Our skin, that is billions of small microorganisms and bacteria, that means that penetrating a bacterium that does us no good, or a virus, is actually almost impossible under healthy and good conditions. That is exactly what I am saying. "5,000 germs are on a square centimeter, that is their home, there they take care of the regular defense. If I now have a large parking space in front of the metro and it is full, that means when it is full there is no more space for a car, that means no one can get in between somewhere, and so it is also on the skin. That's why it's a little bit not fair to say please sterilize yourself and disinfect yourself at any time, but let's work this environment for us, because there is no better defense over the skin. There is a situation where the entrance gates are open, and that is the wound. Therefore the wound also needs a care, and if a wound now arises, then a cascade of self-regulation and help to close the wound from the inside. But as long as the wound is not closed. Processes can now of course infect, and infection means redness, maybe a little bit of pus. That means it's all processes that the immune system is now starting, and you can support this process significantly, that it does not lead to a strong inflammation, that it leads to a quick wound healing, that another disinfection does not happen anymore by disinfecting it well, also sterilizing and giving this process. A few days and then it's all forgotten. That means this skin barrier has a very big task for the immune system. The other, for example, is the mucous membrane barrier of the stomach. If the stomach has a pH value of 1.13 to 4 maximum, it is a high deep sour environment. And if you remember, maybe in the context of our last award, the award from the sender QS24 TV, there was so wonderfully talked about the Heliobacter, that until Heliobacter was not discovered, Heliobacter pylori was a friendly or stomach-friendly bacterium with all its positive tasks for the stomach, and the stomach as a protector in front of the entry gate into the intestine has essential tasks, and they are certainly also due to Heliobacter. They are determined by the good here prevailing high sour environment, so that we regulate before, so that bacteria that do not belong to the body, so that viruses, parasites and fungi are killed beforehand. That has a task, and we are doing well if we make this microenvironment our task. Again, in the context of a normal and physiological attitude, and not for years to decades. The stomach acid production massively block, for example, through proton pump inhibitors. Every individual case is an individual, but that they are freely available today is for me one of the most irresponsible things in the world, because we do all not consider the following developments. Our knowledge and our behavior is much too little. So we do not decide that if something gets into the intestine now, that we completely overwhelm our body because it only has its limited immunity, and if we then have an increased mucous membrane permeability, that means that the mucous membrane barrier is weakened, then these burdens of course also penetrate the mucous membrane and get into the blood, and now a swelling fire is created here. That means the immune system rattles and rattles and rattles and is only busy with it every day to bring it back into balance over inflammatory processes, which actually should have been the task of the intestine for a long time, and that is why it is such a concern for me to talk about this point in a little more detail. And the other thing is, of course, the intestinal barrier. The intestine, in its huge cross-section of 400 square meters, that is a huge mucous membrane that makes up 80% of our overall immunity. And which of course carries 1 billion microorganisms inside, and these microorganisms, these bacteria that take care of everything. If you are a doctor trained in natural medicine, Then you learn that first that the mucous membrane immunity and that the intestine as the root of the plant human being have the greatest priority in the treatment of diseases because that's where it all starts and upwards that may develop here to diabetes there to autoimmune disease there to the tumor there to the migraine but, without not having a picture of it. I think it's a bad thing, because the other thing is always just a little bit of what it then really shows us, but it is not the cause, and we are talking about these billions of microorganisms from a so-called colonial resistance that means the real balance of this microenvironment is due to a really almost cosmic intelligence for my terms. And the body knows all by itself which microbes it needs in this area of the intestine. If the small intestine has a pH value of 8.5, then that is important for the metabolism for the digestive enzymatics and for the provision of enough digestive end products. That means what the body has to go through now is prepared here in this important part of our body and immunologically checked so that only the best comes into the pot so that the body, the blood that I have to rebuild every day, I say, from the organism, it has to get into an important balance over the intestine again and again. And the large intestine has completely different tasks. The large intestine now has to thicken the end products, it has to produce a stool that is healthy that separates itself. A healthy stool does not need toilet paper or just rinse it with water that would be healthy, but a stool that smears, that blocks, that only separates as little beads like a deer, that is constantly watery, that is highly pathological like a flan, that is not all healthy, and that you should not overlook this and think that has developed over the years, and because that is so it is so and you learn to live with it. That is something where I have to tell you, the body will have to go down somewhere. And I would like to show you on another slide which defense system we actually have in us, because there are two big ones. One is what we humans are born. We also speak of the innate immune system that means this. Can be used by every person. This is sharpened as long as we live in the daily conflicts on the fronts of the mucous membranes. On the conflicts with the loads that we breathe in through the air. This immune system that really does everything for us and is immediately ready when we are injured to close wounds to attack pathogens. I will introduce it to you in detail, but this innate immune system will only develop in a good, healthy and strong way if we, for example, breastfeed for children. When the birth is a healthy vaginal birth, and if we also give our children the discovery of life, if we do not raise our children too sterile, if we do not constantly make sure that they are not allowed to touch anything but that we build an immunity for the children. With the many small thousandfold impulses that a rich, healthy, strong immune system also demands. If we do not demand anything, we cannot expect it to be strong, and the conflict with these things, whether it is viruses, whether it is bacteria, whether it is parasites, are now calling on the organism to provide for supply, to provide for speed. And I say a line of defense that patrols everywhere, that constantly prevent the spread of pathogens, and that are fast and very agile, and of course always callable. And I think I will come to, in the next show, to introduce these actors of this first line of defense, that are the macrophages that eat everything away as a profession, that are the dendritic cells, and that are the big ones, that are the garbage men, the macrophages, that are the ones that clean everything immediately afterwards and leave it clean. In this sense, I thank you very much for all the attention in the last 20-25 minutes, and I look forward to the next show, and we will have to continue a bit there because the innate immune system has also a acquired one, and these are the special units. Looking forward to it. Goodbye.